Hello, everyone. Good afternoon. Greetings for the day. I'm Sayukta from All About Skin Wellbeing, and I'm sure all of you must be keeping good health. We all know that taking good care of our skin is important for more than just our appearance. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infections can look like a rash, which can be really itchy and annoying. Antifungal medicines treat fungal infections. Antifungal medicines can kill a fungus or they may stop it from multiplying or growing. There are several classes of antifungal medications and different types of medicines as well. So the bottom line is that please do not self-medicate. Don't go for over-the-counter medication. What is important is that whenever we see any kind of infection, be it fungal or any other, we need to go and consult the right person, which is a qualified dermatologist in case of fungal infection. So let's connect today with our skin expert, Dr. Amee Daxini, live from Bengaluru, Karnataka, to enlighten us on the topic of antifungal and fungal infections. Dr. Amee Daxini is the founder and senior consultant at Think Skin Clinic. She is a dermatologist and conducts regular training for dermatologists in advanced procedures. She has done her MD in dermatology from Mumbai University, advanced training in mesotherapy from Aesthetica, Spain, advanced facial sculpting from Elegant Dr. Arthur Swift. And she has special interest in facial aesthetics, lasers, Botox, threads, and fillers. It's such a pleasure to have you with us, Dr. Amee Daxini, and share your views with us on antifungal and fungal infection. A very warm welcome to you.
Thank you so much, Sangeeta. I'm so glad to be here today because I think with the monsoon setting in the entire country, fungus is something that everybody is, coping with. And at times, because it's so persistent, we stop taking expert advice and we just try doing things on our own. And I'm really thankful to all of you, to bring this out on such a large platform that it might help so many more people who are still confused about fungal infections.
You're so correct, doctor. I'll completely second you on that. Fungal infection is indeed very common, especially in these, times where it's raining in almost all parts of our country. And plus, but because it's a tendency of our society, we believe or have more trust on home remedies or over-the-counter medication because in a way it's more accessible as well. But only time we go and land up to the doctors when the things have gone really out of control. So let's alter that. Let's spread awareness about why it's so important to consult a dermatologist at the very first place. But first of all, doctor, we would like to understand what is fungal infection? What are the risks associated with fungal infections?
So the thing we need to remember is that fungus is another type of pathogen, like maybe a virus, COVID, or you look at bacteria where you get pneumonia and things like that. So it's another pathogen. But the thing about fungus is that it starts generally appearing only on the skin because it requires a hot, humid atmosphere to grow. So most fungal infections are superficial fungal infections which affect the skin. They're also known as mycosis. And as you rightly said, there are multiple different type of fungi. Like we have different bacteria, we have different viruses, we have different fungi. And they cause different kinds of skin diseases. Very rarely, it affects even our mucosa. What I mean by mucosa is areas which gain entry into the body, like our mouth as well as our private parts. So at times it can also affect those areas. Very rarely in very immunocompromised people where, they're either on chemotherapy or they're severely diabetic. That's when we notice fungus entering our body through the blood and affecting different organs. But 99% it's always on the skin, nails, as well as mucosal areas. So that's why fungi affect us.
Right. And as we are talking about fungal infections, doctor, as you said, it's more common on our skin, on nails. We also know that fungal infections affect our scalp as well, right? We'll talk about all these, but which are the areas, which are the body parts which are, more prone? We know that for sure those areas where it's sweating a lot or sweat gets accumulated, etc. So what are those areas to keep a check on?
See, dear, it's like very simple. Wherever there is moisture going to be collected, that's where the fungus will love to grow. Now, one thing I want to tell all of our viewers is that fungus is normally present on our body, in the atmosphere, in the things that we touch. But why don't all of us get infected then? The
Mm.
reason is that the fungus can only penetrate our skin in presence of moisture. So when there is moisture is when will it penetrate. So very commonly the areas mostly affected will be all the folds, starting from our arms, under the breasts, in the groin area, in the back, in between the buttocks. And the minute they get into the skin, then they have a tendency to spread. So then they start growing. And, one of the common terms that we use for skin fungus is called ringworm. The
Right.
reason is that these come in form of rings. So when they grow in such a way that they form a ring, and the most active ones are at the periphery. The center starts clearing out. So that's why it's typically like a ring. So that's how we see these fungal infections. And, unlike our bacteria and viruses, it doesn't cause any major problem. Like it doesn't cause, fever or pain or redness. So we don't give it so much importance, until it becomes so bad and the itching is so uncontrollable, we just let it be.
Right. And as we were talking initially, one tendency that we have is to go for home remedies or ask a friend or family or go for over the counter medication. Chemist shops are so easily accessible in our society. We'll easily go there and ask for any antifungal cream. Now, we know that, if it's steroid based cream, initially it will work, at least superficially, it will work wonder and will fall prey to it, or else I mean, we have so much of trust on these over the counter medications. What's your take on all these, doctor? Over the counter medication, asking a friend or family, or home remedies?
Yeah, no, I can't tell you how many resistant cases I see of fungus just because they've used the wrong treatment, And as you very rightly said, over the counter, they give these, it's like, kahin se to tir lag jayega. It's like quadriderm, which has an antibacterial, antifungal, steroid, everything in it, antiseptic. So ye nahi to ye, kuch to lag jayega. But the
Right.
problem with this is the minute you stop it, it's going to come back, the fungal infection, plus it'll come back with a vengeance. So it'll like really spread badly. So that is one really big thing that we need to prevent in our society, And of course, asking friends. So, somebody just remembers, oh, she had something like this. I'll just call her and ask her. Now, in 50% of cases, it might work too. But unfortunately, right, every skin reacts and responds differently. That's one. And secondly, many a times the fungi are different. As we said earlier, there are different varieties. You have a
Right.
candida, you have a trichophyton, you have different varieties, which one doesn't understand because you're not an expert. So you use the same cream, probably what your family member used, and subsequently develop resistance, And then if you're trying to use the same, medication again, there will be no response. So here a word of caution to everybody is that avoid self-medicating, not because it may not be the right drug, but you may not use it in the right duration. Yeah. To give you one example, suppose you have a toothache and you go to a dentist, right? They give you an antibacterial tablet, an antibiotic, and says you have to finish the course of 5 days, suppose, or 10 days, right? And we stick to it. We finish that 5-day course because if we don't, we'll develop resistance. The same thing is with antifungal. Unfortunately, antifungal courses are very long. They all start from 14 days to almost 3 to 6 months. So we have this tendency that, medicines to chemical hai. I can't have so much chemical in my body. Thoda sa theek
Right.
ho gaya hai, I will stop it. And the minute we stop, we are ready to develop resistant fungi. So these things I really, want to share with everyone because I see it daily in my practice. And I think we are also guilty of doing it sometimes, even in our own house,
True. True. True.
When it comes to children, we say, Are, itni dawaiyan kyun deni hai? Why should we give so many medications and so many chemicals? And we just stop it. But when it comes to fungi, they love it because they can then proliferate more.
I no, that's very natural, right? That's a human tendency. Even if I ask somebody to have water, they'll have it because it's natural. But if the moment I say that have H2O, they're like, what? What chemical are you asking me to
Absolutely.
have? That's how it is. Turmeric is natural for us, but then turmeric also has natural chemical, name.
Exactly.
So it's like that. But anyways, the whole purpose of having this session, Dr. Ami, is to spread awareness that why
Yes.
you need to go and consult a doctor and how badly
Yeah.
fungal infection can go. Now, another thing we commonly hear about fungal infection is the recurrence. It will come back. Those who are prone keep on having it. So why it happens and what's the way out, doctor?
So, here I'll go a little longer. I'll divide the kind of fungal infection so that you understand
Sure.
it better. Yeah. So,
Right.
the first type of fungus is something which is most superficial. We call it as tinea versicolor, and it is just round patches of maybe a white or brown color that just comes on the shoulders, especially the areas where we sweat a lot, especially these athletes and gym goers and those people. Now, that is the most superficial fungus, and it goes very quickly. Within 30 to 60 days, it completely vanishes. The problem is that this is a little more genetically prone. So if you are prone to developing a tinea versicolor or the superficial fungus, you're going to get it every summer. So it's not that, you've taken treatment now and then next summer you will not. There is a tendency that you keep getting it. Each time you get it, you need to use those proper medicines and it will subside. So that is a genetic tendency. Now, the second type of fungus is a little deeper. That's what is the ringworm. They, grow in areas where it's very humid and they tend to spread a lot and they cause a lot of itching. A lot of symptoms come with the deeper fungus. Now, these cases, if not treated correctly, at the right time and for the right amount of time, they tend to recur every 2 to 3 months because 10% of fungi generally remain dormant even if you've completely treated the patient. 10% is always over there. So here, lifestyle is extremely important. Keeping your areas dry and clean, washing your clothes regularly, not sharing your personal items like your towels or bed sheets, or even blankets with other people, because you don't know who might have a fungal infection. It comes even through pets and pets hair, like cats and dogs. They also can get fungi, and if they've suppose sat in a particular area and then you sit over there, you have a tendency to develop tinea or fungus. So a good lifestyle is very important to prevent recurrence. And then of course comes the nails. This is the most difficult and long standing treatment that we need to do, and they tend to recur for two reasons. One, if you do not stop dipping your hands and doing excess work with water, they tend to come back. And the second, especially in the in the toes, is when you wear those tight fitting shoes for a long time. So what happens is there is no air between the two toes. And that's
Right.
when you start noticing in between the toes, there is a lot of fungus that grows and they stay for much longer. So taking the right kind of treatment, using it for the recovered period of time, that's very important. And third, making those lifestyle changes. These are the three things that can help prevent recurrence.
Right. So, as we always say, that prevention is better than cure. So, I think these are the things that we need to keep in our mind
Yeah.
and stay away. And in case we get to have, please go and consult a qualified dermatologist. That's really important. Specifically because these days, doctor, there are so many online influencers, there are quacks, etc. So please refrain from all this and go to the right person, which is a qualified dermatologist. Now, talking about antifungal medications, doctor, how do they work?
So we have multiple kinds of antifungal medications, some that penetrate deeper, some that are more superficial, depending on the kind of fungus. The key thing is that there is one antifungal medication which is taken orally and one set which are applied as a cream. Now, initially, maybe even just 10 years ago, if there was a very small fungus, we would only give creams, you wouldn't need an oral tablet to control that. But with the development of resistance, we as dermatologists in India have realized that even if it's a small patch, we need to give a combination of two. That is the oral medicine along with the topical cream. So mostly if you go to your doctor with a fungus and once it's diagnosed, they will always give you an oral tablet, which is an antifungal tablet and a topical cream. Along with that, many a times if there's too much itching, we also give an anti-itching tablet, an antihistamine, which reduces the itching. Here, because the minute you start itching, you are creating more channels for the fungus to grow. So itching causes more spread. Also because they settle in your nails and then you touch another part of the body and it's tending to spread. So anti-itching or prevention of itching is very important. So whenever you're on antifungal medications, don't forget to take them regularly. Do not itch. That's very important. If there is itching, the best treatment is to apply oil. Now, why I'm saying oil is that oil does not let air penetrate through the skin. So what happens is the fungus doesn't get that much of atmosphere to actually grow. No air. So it tends to die out and you don't feel like itching. So these are the antifungals, common medications that we, common names that I'm sure most of our viewers will know is one is called Candid. Candid is nothing but clotrimazole. It's a cream. Unfortunately, in India, we've developed resistance to clotrimazole or Candid. So even if you use Candid, you're not going to see complete resolution. The next is Candid B. Now here you have to be very careful. The B is a steroid. So this should not be used by anybody unless prescribed by the dermatologist. So Candid B, please avoid picking up from a pharmacy store and using it. The other good or better and newer antifungals that we have developed now are something called luliconazole, miconazole. We have ketoconazole. We generally use that for the scalp, for dandruff. I'm sure, people would have seen ads saying ketoconazole plus ZPTO. That is for the scalp dandruff, which one of the reasons is fungus. So these are some, products that we use as medications. But again, important, some are in the topical form, some are in the oral form, and they need to go to an expert to get the right course.
Right. So that's really important. Please go to the doctor at the very initial stage and trust your doctor. Complete the whole, whatever dose and prescription they have set you. Doctor, we would also like to understand, as you said, in case of nail fungal infection, the treatment will be a little longer than the normal fungal infection. Normally, people say that, in fungal infection, you need to take the medicine for a long, long time. And they are really, as we were talking initially, that why should I take medicine? Why so much of chemicals or drugs inside me? So how long do you need to take antifungal drugs? What's naturally, how long?
So, see, the fingernails generally tend to show faster results. And by faster, I mean in comparison, faster is almost 3 months. So, we start from 12 weeks to up to 3 months. We need to take these medications because the amount of antifungal getting absorbed by the nail is minuscule. So you have to give so much more dosage so that it gets absorbed by the system and change the nail. Now, if you look at the nail, I just want to show this, to the viewers that the infection is in the bed. That's this area, not the nail. Nail is a dead tissue. So you generally don't see any, what you're seeing is coming from the nail bed. So here in nail fungus, we also give them something called nail lacquers. These nail lacquers also have antifungal products in it. So these antifungal ingredients, right, then they work on the nail bed and reduce the, superficial fungus that is growing over there. But you cannot treat nail fungus topically. You have to take oral medications. And as you asked me, 3 months minimum. It can go up to a year, especially for toenails, because toes, again, it takes much longer for the nail to absorb that antifungal drug. So 3 months to a year, and persistently meet your dermatologist who can tell you and guide you how to titrate the dose.
And what about skin fungal infection?
So
How
skin
long?
fungal infections, depending on the size. So when you have smaller lesions, it can go just from a week to 2 weeks. If there are larger and more spread out disease, then we go from 4 weeks to all up to 8 weeks for oral medicines. But topically, we always advise 2 months. The cream that we apply, do not stop even if the fungus is not visible. Because as I said, we need to finish the course. Otherwise, it has a tendency to come back.
Right. And we would also like you to shed some more light about the scalp fungal infection, doctor. And again, because initially you said that on skin, if you are so annoyed with the itching, you can apply some oil. But what we do, we'll apply a lot of oil on our scalp, thinking that it will take care of the fungal infection or dandruff, maybe because we don't know exactly what's happening on our scalp. So for us, for our scalp, the solution to all scalp related issues is applying a lot of oil and
Yeah.
keeping it for a long, longer time. So what's the right thing to do, doctor?
Yes, so you asked me a very tricky question because we dermatologists are split in our opinion over here. There are
Okay.
some doctors who agree that no, you should apply oil on the scalp even if you have dandruff, and I'll tell you why.
Okay.
And there are some doctors who are totally against it, saying that no oil, especially if you have dandruff. So
Okay.
let me give you the reasoning. So when we say a scalp dandruff, right? Scalp dandruff is a mix of a lot of things, not just fungus. It is because of dryness of the scalp. It's because of the kind of scalp care products or the shampoos that you're using, plus also the oil secretion from your body. So if you would have noted, dandruff generally begins during teenagers. That's when your oil secretion, because you're maturing, your oil secretion is increasing. So dandruff is not just fungus, but it's multiple things together which causes the dandruff. Fungus is just one element. So, application of oil does not change the fungus in any way. What it does is it moisturizes the scalp so that the visibility of the flakes becomes less. But at times, what doctors think is that if you apply oil too much, the antifungal lotions and shampoos that you're using do not penetrate enough. And that's when you don't see the resolution because the dandruff, is caused by fungus partly. So that's one of the reasons that we say no shampoo, no oiling, especially if you have dandruff. But believe me, if you shampoo well and you shampoo twice every alternate days, you can oil your hair safely even if you have dandruff. It's absolutely fine. But use of an anti-dandruff shampoo is a must. Now, here again, we all think, arey, itna chemical wala shampoo is drying my hair is falling, we have all those misconceptions. So here I want to tell all our viewers is that you don't have to use the antifungal shampoo on the shaft or on the hair. You just need to use it on the scalp. So when you are washing your hair, just apply it on the scalp nicely, keep it for 30 to 60 seconds and wash it off. And then for your hair, you can use any good shampoo that you like. So, that will prevent that, problem of drying of hair and breaking of hair and brittle hair. It will stop.
Right. So the takeaway is that shampoos for your scalp, conditioners are for your hair shampoo. So that's
right.
important to note. Okay. And what's the treatment for scalp fungal infection? I mean, as a doctor, what you normally do to take care of it?
See, scalp fungal again can be like a ringworm. You can have those patches, right? We call that as tinea capitis or off the scalp. Now, there we need to give oral medicines, and again for a long period of time. The treatment of choice is an ingredient called a drug called chrysopulvin. So we give that for a long period of time, along with shampoos containing ketoconazole. Now we have multiple other things that also contain salicylic acid and tar. Now, the advantage of salicylic and tar is they help exfoliate. So it removes the dead skin where the fungus grows. So combination shampoos now are the key. So we get ketoconazole with ZPTO, with salicylic acid, with tar, and those are the ones that we use for fungal infections of the scalp. When it comes to dandruff, as I said, there are multi issues, So we cannot cure dandruff. I can cure a tinea capitis, because it's just a fungus, but I can't cure dandruff because it's from within. It's the oil secretion, it's the kind of scalp you have. So we control the dandruff. Yeah. Many a times I have patients saying that, oh, doctor, I used that antifungal shampoo for 2 months. Everything was gone. Now again, it's come back. The only thing is because we think that, okay, ye to khali use karna hai till I have dandruff and then stop it. But no, we got to use it for a long time till our internal system stops, developing that much of oil and dandruff production. So that's the key for scalp dandruff. Yes.
Right. Many times people also ask because they are taking antifungals for at least 2 months in case they have skin fungal infection, or 3 or more months in case of nail, or so on and so forth. Now the question is, what are the potential side effects of antifungals?
Yeah, that is an important question because, we're all worried about side effects. Generally, if you look at the antifungals, they are much milder in comparison to antibiotics. So, many a times we take antibiotics and then we get diarrhea. We get, loose stools. Our tummy gets really upset. That doesn't happen with antifungals. The only thing we need to remember is not to take it without prescription. Now, here I'm very emphatically saying that many times when this fungus tends to recur, we have this habit, last year to hua tha, doctor gave me this antifungal. I will just take that same prescription, restock it and use it. Now, all these tablets, especially oral antifungals, pass through the liver. So, we have certain antifungals that pass through the liver, some pass through the kidney. Now, we decide what kind of person, which one should we give. So if we know that it's an elderly person and he's a diabetic, kidneys are always compromised. So we give oral antifungals which pass through the liver, which are metabolized through the liver. So it's very important every time you get it is to go to your doctor and they will prescribe. Other than that, antifungals do not have any side effect other than severe allergy if you're allergic to that medicine. Otherwise, you do not develop anything. They are much safer than antivirals and antibiotics.
Right. Who are those patients who shouldn't take antifungals? Especially, I'd like to talk about, women who are pregnant or those who are lactating. Can they also have antifungals, or are there other protocols?
Generally, in the first trimester, that is the first 3 months, we avoid giving any oral antifungal. We only give them creams to control the fungus. After the first trimester, that is the second and the third trimester, we can give them if it is persistent. So we use something called amphotericin B, which is quite safe, in giving pregnant women if it spreads a lot. Otherwise, we control it with topical creams, and these creams are safe to use, even in pregnancy and lactation. So that should not be a problem at all.
Fair enough. We have Tina Bhargav with us, a viewer, and her question is, can antifungal medications be used to treat both superficial and systemic fungal infections?
So, Tina, that's a good question because, if you see, antibiotics can be used topically as well as orally for everything. But in antifungals, the dose changes. When it is systemic antifungal, that is, suppose your brain, the meningitis can get, the lungs can get. Now, for that, the dosage is completely different because absorption of antifungals, as I earlier said, is very less. So we need to give IV antifungals for those patients where systemic causes are there. And we have to titrate it basis the spread of the fungus in the body. But, oral medications are generally used only for skin and deeper skin infections, but not completely systemic.
Okay. We have Faria Beg. Her question is, how long should I continue using antifungal medications, and what should I do if the infection doesn't improve or recurs?
So we always give it first 15, that is 2 weeks, first 14 days to see if there is a response. Now, if there is no response in the first 14 days, we declare that the medicine is resistant. As I said, there is resistance that develops. So suppose I start you on, say, terbinafine. and in 14 days, I see not a bit coming down clinically, then we decide that terbinafine is not for you because you're resistant. So we start another medication. Yeah. And that we prolong it longer. So if I was supposed to give you only for 14 days, I will give you double the amount. I'll give you for 28 days. So it's after 2 weeks is when we decide whether it's not working, but always complete the course. That's important.
Right. Shanaya Sen is here. Her question is, how should I take or apply antifungal medications to ensure maximum effectiveness?
So antifungals, especially there is, we call it the azoles, itraconazole, ketoconazole. These are absorbed best in an acidic atmosphere of the stomach. So we generally ask you to take it after meals with something that is acidic, like probably orange juice or musambi juice or lime juice also. So the absorption is much better. The creams are best applied after shower. You apply the cream and reapply it in the evening around 7 or 8 o'clock, not at the time when you're going to sleep. Because when you do it at that time, the problem is that it generally sticks to your clothes or to the bed sheet. So apply it a couple of hours before you go to sleep. That is the key to applying antifungals. The other thing you need to remember is, suppose this much is the area of involvement, so it's maybe one coin shape. You need to apply 2 centimeters more than the involved area. Now why I say that is, if you remember, fungus grows outwardly. So if you want to prevent the spread outward, if you give a boundary of antifungal cream around, there is a less tendency to spread outward. So generally we say, wherever you apply 2 centimeters more than the affected area, and use it at least for 2 months, even if the fungus completely disappears.
Okay, so that's really important. We have Feroz Khan with us. A similar question: can antifungal medications cause allergic reactions or skin sensitivities?
Yes, sure. It can, Feroz. It can cause allergic reactions, especially because of the base. So it's not the antifungus which causes the sensitivity much, but suppose you are allergic to aloe vera, or you're allergic to petroleum jelly, and that antifungal base is petroleum jelly. Then you can develop allergic reactions, but these are always immediate reactions. So the minute you apply it, you will notice severe redness, itching, burning sensation. Immediately go to your doctor and they will change the base for you. So topicals we do see because of the base. Orals generally we do not see. In very rare cases do we see a hypersensitivity reaction.
Okay. Now, doctor, coming back to to fungal infections and how it affects us. A very common property of fungal infections is, I guess, that they are, highly contagious. It can easily spread to one to another. Now, the thing is, in a family, what should the, other family members do, or what should the person who is having fungal infections do so that it doesn't spread?
Yeah, that's really important, because a fungus is not as contagious, say, as chickenpox, but fungal, the spores of the fungus stay much longer. So if a person with, say, fungal infection has sat on a bed for a long time, or a pet has been lying there for a long time, and if you sit over there and there is excess humidity, there is a tendency that those spores can stick to your skin surface and then start growing there. So family members should be very careful as to where, the person has been sitting or resting for a long time. The bed sheets should be cleaned more frequently. Clothes should be washed daily. Now, in monsoons, what happens is that our clothes don't dry quickly, especially our undergarments, and sometimes we are forced to use a little moist or wet, garment. Now, that is a complete no-no, because that's the area, the right environment for the fungus to grow. So ideally what one can do is we can iron out the undergarments, So when it's a little moist, turn around and iron it, especially on the seams. That's where the spores stick. So you can iron it in that area so that you don't have the problem of the fungus spreading. That is one thing you can do. The second thing one can do is, wear disposable undergarments, which I feel are okay. You can use disposable undergarments and, dispose it off, especially if you're traveling and you know that it's going to get wet. You can use that. So that is one thing you can do. The other is when you're washing the clothes of a person with fungal infection, it's better to use hot water. So if you're a family and you're putting it in the washing machine, it's fine because the heat will kill the spores. So that's not a problem. But if you're washing it by hand or in a bucket, then it's better to wash it separately in hot water so that those spores die out. Those are the eggs of the fungus. So they die out. And the third important thing is do not share personal items, especially towels, because they tend to spread. I also advise my patients who finish their course of a month or 2 months is to change completely their undergarments. So just change your towels, change your garments, change your bed sheets, so that whatever redundant fungus is there doesn't come back to you.
Right. Now, doctor, in a family, in a house, we are in a controlled, environment where we know, okay, so this family member is infected and we need to take care of the things, etc. But otherwise, where the, environment is not that controlled, like in gym, while using public transportation, etc. We don't know who is the one who is infected and how to, take care of ourselves,
Yeah.
especially for those who are prone to it, specifically in this, monsoon weather, what we can do.
So ideally, it's best to be safe. As you said, prevention is better than cure. So each
Right.
time you're using a public place, like a gym, or you go to a park, or you're going out and you know that your body has touched or got exposed to multiple things, best to come home, change your clothes and take a shower. That's the best, because you don't know whom you've touched, what you've touched, and how it's going to affect your body. The other thing that you can do is that, there are these powders, antifungal powders that are available. So if there is no time and you feel that, okay, I have to come and rush back to office, it's best to put or dust those powders in the areas where the fungus can grow, so your underarms and your, genital areas and everywhere. So at least it's a good stopgap arrangement until you shower. So that's what you can do.
Okay, I'll take one more question from Rahul Batswar. His question is, if I have a history of allergies or sensitivities to certain medications, should I be cautious when using antifungal treatments?
Yes, you should. So you should find out typically what you're allergic to. It's important to know that. And then cross check with your doctor whether that's present in your tablet or your oral medicines that you're taking. So it's important. Also, certain antifungal agents have a cross reactivity to other, products or other drugs, like probably if you're taking something for depression, so that medication and a medication antifungal called terbinafine cross react. So you can't take those. There are some BP medicines also which you can't take with certain antifungals. So important to give your complete medical history to your dermatologist before he or she can prescribe something.
Okay. And doctor, before we wind up the whole session, any take-home message for our viewers?
So I think India can get fungal free like many other countries in the world if we become smart. And for that, three very important and but very simple things that we can do. One is avoid self-treating ourselves or going over the counter medications, please, that develops resistance. Second is take care of your lifestyle. So if you are clean, neat, and you wash things regularly and you wash yourself regularly and keep yourself clean, you will never face fungal infection. And the third important thing, and I think that's the most important for all of us, is to complete the course prescribed. So if you do these three things, I'm sure in the next few years we'll be fungal free in India.
That would be wonderful. It was such a pleasure to interact with you, Dr. Amee Daxini. It was such an informative session for all our viewers, I'm sure. Thank you so very much for joining.
My pleasure. My pleasure.
And we really look forward for many more such sessions in the coming times with you, Doctor.
Anytime.
Thank you, Doctor, and thank you, viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day to all.